Good evening. On behalf of Jacksonpal Pharmaceuticals Limited, makers of Toxipal DRL doxycycline 100 mg capsules, the drug approved by government for treating COVID-19 patients. In the fight against coronavirus, Lycorate soft gels provide the required defense to boost the immunity, and Nari-Cal tablets containing calcium citrate malate, folic acid and vitamin D for today's Nari. I am Dr. Vipin Tyagi, along with my teammates, Dr. Deepika Chhabra, Mr. Amit Saxena. We welcome and thank the office bearers of the Association of Obstetricians and Gynecologists of Delhi, AOGD, for organizing this online group discussion with challenges and solutions for a very pertinent topic of mental and social well-being of healthcare workers in COVID era. President Dr. Achla Batra, Advisor Dr. Pratima Mittal, Vice President Dr. Jyotsna Suri, and Honorary Secretary Dr. Monika Gupta. We welcome all our esteemed faculty present with us today. Welcome to all the attendees. Please post your queries by text in the Q&A box to be answered at the end. Please note this webinar is streaming on Facebook Live. The recording will remain on Jacksonpal's YouTube channel for reference and promotion. I will now request AOGD President Dr. Achla Batra to kindly initiate the session.
Namaskar, good evening, and wishing safety and good health to all of you. In the last 1 year, we have been through a very, very tiring time, both physically and mentally. And mental health is one of the strongest pillars of health. It has been seen in research that each and every cell of our body needs, our happiness to work actively. In Latin, placebo means to bring pleasant things. And when you give a sugar pill to somebody with vague complaints and she becomes okay, it's not the sugar which has corrected her. It is the belief that she's got something good. And there's another word in Latin called nocebo. That means I bring bad. The bad thoughts, they take you the opposite way. So we have seen in this one year that, our doctors, they are getting stressed, they're getting mentally fatigued. And we do have hormones in our body like, endorphins, dopamine, oxytocin. They are, the hormones which make you happy. So in today's talk, we have with us eminent people to tell you the dimension of the problem, how to recognize the problem, how to get over this problem and make, boost your happiness hormones. And I have with me my mentor, my advisor, Dr. Pratima, my Vice President, Dr. Jyotsna, and Honorary Secretary, Monika Gupta, to do the program. So first of all, it is my pleasure and honor to invite Dr. Kamal Bakshi. And I have a CV slide. I don't think she needs any introduction, but Dr. Buckshee has been, one of the strongest pillar of AOGD since its inception. And she has been the FOGSI president also, and she has many firsts to her credit, and she's been an achiever through her life and has been recognized for that. And she, when she talks, it gives us motivation. So Dr. Buckshee, I would, request you to just say a few words for this webinar and to the people of Delhi. Dr. Buckshee, ma'am.
Good evening and namaste to everyone. My special thanks are to Dr. Achla Batra, our president, of AOGD, for inviting me to this august and excellent gathering and conglomerations of the great minds who have gathered here to see that as far as COVID is concerned, he is away and he knows that these people are strong. They won't let us near us. Dr. Grewal ji, I think he'll be coming shortly.
Yes.
Yeah, okay. And Dr. Grewal ji would be coming shortly.
I've joined you. How can I not?
Oh, namaskar, namaskar. I would say Dr. Grewal ji is a great human being.
Oh my God.
With a golden heart, with a lovely mind, and with a human being who keeps his feet on the ground, but looks towards the horizon. Yes, हमने सब इस ऊपर चट्टानों में जाना है और कोविड को भगाना है और हम इंडियन सिटीजन जिंदाबाद रहेंगे और हौसला हमारा बहुत अच्छा है। नमस्कार जी। डॉक्टर प्रतिमा, डॉक्टर अचला, ज्योत्सना, सूरी, मोनिका, जुगल, किशोर जी, डॉक्टर पंकज वर्मा, you all have teamed together and we used to look at Safdarjung, and now you have changed the face, the standard of care that you have and the quality which everybody envies. My namaste and congrats and thumbs up to all of you. Dr. Manju Puri, whom I can't see at the moment, but she is a teacher of teachers and even my teacher. What enthusiasm and energy she has. She's wanting to train our Indians, our health workers. What? Ethics. Ethics is a rarity when we became the slaves. Ethics was in our culture in the days when Vedas were there, our good olden history. We were the founders of science. Anyway, we will be back again, to teach ethics, to teach quality, to create awareness and the advantages. Dr. Manju Chagani, congrats to her. हमदर्द दवाखाना हम आगे से गुजरते थे, लेकिन आज जब गुजरते हैं तो निकाहें झुकाते हैं कि it has come to the forefront. It has such a great load that is there, and people now want to go and have a medical education. My special thanks to young Anu to have a fearless mind, and to my another young colleague Poonam Bagga, so that we should have a lifestyle. क्या बार वालों ने केंटकी खोल खोल के हमको मोटा कर दिया, हम लोग तो slim and nice, Look at our physics of even our gurus who teach us pranayam, and we'll be back to those days. नमस्कार जैक्सन पाल जी, कम से कम आप नारी के लिए आए हो, बहुत अच्छा है। आप ना होगे तो नारी कहाँ जाएगी, नारी होगी तो दुनिया होगी। Now, when our families, our friends, our healthcare professionals, each house has been visited by COVID. जब हमारा प्यारा, it may be our husband, it may be our daughter-in-law, it may be our son, it may be a child. जब उस घर से वो इंसान जाता है, तब हम स्टैटिस्टिक की बात नहीं करते, उनका प्यारा जाता है. So it is but natural that the minds will be stricken with panic, grief, fear, and all kinds of problems. It's a human nature. और जब हम क्या कहते हैं, जो आपका दिल करता है वही करो. If you feel like crying, cry. Get the sorrows, but don't keep on lingering over the problem. Don't keep the problems always. Otherwise, you will not be able to wise. You will not be able to take care. Now, we as healthcare workers, the biggest challenge to us today is जो morbidity or mortality team together to bring it down by uniform guidelines. ये नहीं कि 1000 लोग हैं तो 1000 guidelines, मेरी ये है, मेरी है. ये मेरा मैं ego छोड़ दो. Uniform and follow, and that is where we must, and we have been saying for last more than 1.5 years, mask, 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 and distancing. I will give you an example from Fortis. I was going towards my home and I wanted to buy the fruits. So मैं उतरी, किसी के पास mask ही नहीं था. To the young boy I said, please wear the mask. फिर एक अच्छे इंसान थे, उन्होंने कहा मैम साहब कह रही तो पहन लो. उस यंग वन ने क्या कहा, अचला जी, अरे एक कोरोना तो खाली गाड़ी वालों को होता है, हमको नहीं होता. Let every citizen know that corona does not distinguish between a journalist or a politician or a lawyer or a rich or a poor. So many lives have been lost. So please follow and listen and be united. अब तो कोरोना villages में भी जा रहा है. मान जाओ, सुन लो और अपनी country में come together to help each other, whether you are big or small. My biggest problem is जिस घर में से suppose the husband is lost, the children get upset. The mother has to now watch, बच्चा कहीं स्मोकिंग तो नहीं कर रहा है, कहीं अल्कोहल तो नहीं छुप के पी रहा, कहीं ड्रग्स तो नहीं ले रहा, कहीं कुछ और तो नींद में नहीं कर रहा. So we have to see many priorities. So sort your priorities and look after your mind. And as we wash our hands, we have to clean our minds. Clean our minds by taking the problems away, infusing them with the positive mind, infusing the energy, so that we urge everybody that set your priority, set your goals, and thus we fight it. If you allow me a second, I was reading in the newspaper, the lawyer said, ये भाई हेल्थ केयर वर्कर्स बड़े अच्छे हैं, इन पे फूल भी बरसते हैं, सब कुछ भी होता है, but they don't realize that we healthcare workers sacrifice our lawyers. ठीक है, lawyers को भी हम healthcare workers में मान लेते हैं, but in the same breath, I would like to say each and every healthcare worker should say, जितना ये lawyer कमाता है, वही कमाई हमारे healthcare worker की होनी चाहिए. तब तो बिल्कुल ठीक है, तुम भी आ जाओ हमारी गैंग में. वरना तो सब डॉक्टर चाहते हैं, पर कोई उसकी तरह अपनी जान देने को तैयार नहीं है. आओ जान दो तो लड़ो अपने देशवासियों के लिए, यही इसी को हम कहते हैं. मुझे वैक्सीन तुमसे, अगर मैंने किसी से एग्जाम्पल सीखा है तो वो एक कंट्री से आंधियां आई, तूफान आए, सब चले गए, वो भीख मांगने नहीं गए, उन्होंने तू मैं नहीं करी जैसे हम बैठ के गालियां ही देते रहते हैं. जापान जिंदाबाद. I visited that country. What? No bribery, nothing, commitment, discipline, everything. Thank you for listening me. I am all here to learn from you and to be team. I am so happy with the young blood because I wish I could be young again. मैं तो एक पत्ते की तरह पेड़ से गिर गई हूँ, हम वो पत्ते इकट्ठे हो गए हैं, न जाने कब अपने वालों से मुलाकात होगी. Thank you. जय हिंद.
Thank you so much, Dr. Bakshi, for elaborating the problem and giving the perspective to a problem we are having. And we always listen to you, with such admiration that how you think and how you put it forward. Thank you very much, Dr. Bakshi. We have with us Dr. J.S. Grewal. I have a very small association with him, but the few moments I have talked to him, I found him a very, very humble person. He is the president of Delhi DMA, and he is the chairman of Wellness, Health and You Association, advisors to elder care, mentor, age-friendly, and Dr. Grewal. Through him, I thought we will also, connect to people besides gynecologists. And over to you, Dr. Grewal, for a few words.
Thank you, Dr. Batra, and a very, very special warm greetings to a great lady, Dr. Buckshee, who's so humble. And all of us need to learn one thing. She was invited here to speak. And remember, she had her notes ready. So wherever you may reach in life, if you need to give respect to the others, you got to prepare yourself. Ma'am, it was wonderful seeing you with the paper that you don't take any moment where you are invited lightly and you want to contribute. I think that needs to be adopted by all of us. We see so many times speakers also called, and all that they do is just copy, paste, copy, paste. It is the originality which a person contributes at any platform that makes the platform worth it. And the originality can only come when you speak your heart and mind out. So ma'am, you always speak your heart and mind out. And the topic today is the health of a health professional. And what better guidance than Dr. Buckshee can give? I'd like to share a small little thought, ma'am. Mostly in North India, doctors are called Dr. Sahab. All our patients address us Dr. Sahab. The legacy of the British is that the Sahab was a person who used to give things. Sahab to bade aadmi hai, DC Sahab hai, magistrate Sahab hai. Now you are addressed as Dr. Sahab. And after you've seen the patient, you say, paise nikalo, meri consultation do. So there is a conflict in the thought process. कि ये कैसा साहब आ गया, ये तो पैसे मांगने वाला साहब है. Not many physicians understand the psyche of a person when they come to pay you, because they feel that they have purchased you. I speak to so many physicians who feel stressed out in dealing with patients. That's the biggest challenge. How can a doctor be stressed by his patient? And I tell them only one thing, man. I tell them, you are not handling your patients the way you should handle them. Every person is different. So when we are talking about health of the health professional, there is a physical part, but I'm more worried about the mental part. During last year, nearly 100 doctors in Mumbai in one of the hospitals reported for psychological help and counseling. Now, they were all those people who were otherwise living normally. I asked a question of a psychiatrist in Max Hospital that how many doctors do you feel, consultants in your hospital, require mental health support? He says, medicine may be around, पहले तो वो डर गया. कहता डॉक्टर ग्रेवाल आपने मेरा नाम कहीं ले दिया ना तो मेरे को बाहर निकाल देंगे. I said नहीं बोलो. He says 25% require medication and 75% require counseling. So remember, let's stop this halo around us कि हम तो साहब हैं, हम बहुत बड़े हैं. We are human beings. As ma'am said, we have emotions and we are dealing with people who come to you keeping their emotions at stake. Doctor Sahab, main marne wala hu. So remember, I'm very happy that this topic has been taken up. I request all the speakers to be very forceful, very frank, and to come up with at least some suggestions as to how the healthcare professionals should look after their health. One of the gynecologists in Apollo Hospital nearly 4 years ago on Doctor's Day celebration said that she found out Apollo Hospital gives a free package to all their consultants to get their own health checkups done. And do you know they have about 600 consultants? In that year, it was Dr. Ranjana Sharma who told me this, because I can quote her name because it is authentic. She said only 110 people had gone in for the package that year. So that is the level of callousness. So we are neglecting ourselves. So who's going to check you? Doctor, नहीं मैं तो ठीक हूँ यार, मेरी diabetes हाँ 250 आ गई, मैं तो ठीक हूँ. So please get peer pressure for looking after your friends about their own health. I think, thank you for permitting me to say these words of fell from my heart, and congratulations to the organizers to take up this topic. Please take it up more often. And coming from the gynecology department to talk about healthcare professionals, I know all ladies say that we have two roles to play, the professor of gynecology and the mother at home. So all of you are stressed even otherwise. And the world expects you to be Devi Ma. So big challenge for the gynecologists, and I'm glad gynecologists are talking about the healthcare professionals. Thank you very much. And once again, congratulations.
Thank you, Dr. Grewal, for those, really thoughts and words which are in everybody's minds, but probably we don't say it. And thank you for appreciating the gynecologists. I think now without much delay, we will go on with our programs, which is going to be facilitated by Monika, the Secretary AOGD, concluded by Jyotsna, our Vice President, and expert comments by Pratima Mittal whenever required. So Monika, over to you.
Thank you, ma'am. And a big thank you to Kamal Bakshi ma'am and Grewal sir for, encouraging all of us. And you have actually pumped in the enthusiasm for which we were thinking, healthcare, yes, we do neglect it. And so we thought it pertinent to be just a healthy discussion amongst experts. And I really hope we are able to reach some or the other conclusion for the healthcare workers who can look after themselves and think about themselves as well, in addition to taking care of patients and families. So without any further delay, I would just introduce the galaxy of experts we have in this discussion. That is why we chose the concept as a online discussion rather than individual presentations. They would be as and when the expert chooses may present, but we will be kind of doing a discussion amongst ourselves, and anybody is welcome to pour in the comments whenever required. So first of all, I would introduce the epidemiologist in our expert panel, Dr. Jugal Kishore, whom I personally know as a very nice, experienced and humble teacher. He's the director, professor, and head of the Department of Community Medicine in our hospital, Vardhaman Mahavir Medical College and Safdarjung Hospital. He's been a fellow of Indian Association of Public Health, National Academy of Medical Sciences, International Medical Science Academy, many professional, international and national organizations. He is, especially to his credit, are the Rashtriya Ekta Puraskar, Dr. S. Radhakrishnan Memorial Teachers Award, and the IMA President Appreciation Award, also the Chikitsa Ratna. So, he's a well decorated person, very humble and very knowledgeable. I'm sure we'll learn a lot from him. Next, I would like to introduce, can I have the next slide, please? Teachers of teacher, my teacher as well in my undergraduate days, Dr. Manju Puri, as Dr. Kamal Bakshi had very rightly introduced already. She's director, professor and head of the Department of Obs and Gynae in Lady Hardinge Medical College. So she will be playing the part of the, the obstetrician perspective course, and as an administrator, being the head of department of one of the premier institutes in Delhi. She has lots and lots of prizes, as you can see on screen, to her credit. And she is the national facilitator of adolescent health and quality improvement. And currently, she is also the chairperson of quality improvement, the Safe Motherhood Committee, subcommittee of AOGD as well. So welcome, ma'am. Next, I would introduce the meditation expert, and that too an international meditation expert all the way from UK, Dr. Poonam Bagga, who's actually a consultant ophthalmic surgeon in Northern Lincolnshire and Gould an NHS Trust in UK. And she has been practicing this, as a meditation expert and executive coach and mentor since 2014 onwards. She's the chair for organizational culture change and member of steering group of staff well-being since 2018, and also director of clinical studies in Hull York Medical School. She's the director of clinical studies, which I've said, and associate director of clinical studies. She was associate director in 2006 to 2011. So welcome, ma'am. Next, I'll introduce the psychiatrist in this expert panel, Dr. Pankaj Verma. He is a specialist and professor in the Department of Psychiatry, again in Safdarjung Hospital. He's the nodal officer instrumental in managing the FOGSI patients referred from LRS Institute to Safdarjung Hospital, and member of Board of Assessment of Mental Disability, member Delhi Child Protection Unit Inspection Committee of South District, and also departmental nodal officer for NABH accreditation. So welcome, sir. Next, we have, as Dr. Kamal Bakshi had described, the young Anu Krishna. She's the psychologist in our expert panel. She's the co-founder of Unfear Changemakers and Soulful Exploration organization. And she likes herself to be called as a mind coach, energy work specialist, Zen lifestyle expert, and inspirational speaker. She is energy work specialist in Institute of Inner Studies in Manila, diploma holder in art therapy and law of attraction practitioner, creative writer, Karnataka chairperson for coaching of All Ladies League Women Economic Forum, executive member of Indian Association of Adolescent Health. And I can just explain in one word. I had a talk with her for 10 minutes and I already felt inspired. So this is her, this is her welcome from my side. So welcome, Anu. And last but not the least, we have Dr. Manjar Chagani, who was former dean and presently the head of the Department of Obs and Gynae Nursing and Paramedical Sciences in Jamia Hamdard in Delhi. I have had personal experience of working with her when I was faculty in that institute. And she's a prodigious leader, trainer, researcher, and academician, and always on the go with her colleagues and her juniors, always encourages them to do more and more of academic work, which is the tradition of Hamdard Institute. She had initiated the Society of Midwives in India and initiated Delhi chapter, followed by so many chapters in other states. She's a certified assessor of National Assessment and Accreditation Council. She has contributed to development of various guidelines and also the development of very important skill labs. She was part of that team, which led to the development of these skill labs. And of course, external assessor as NHRC and dynamic member of other international organizations. So welcome, Dr. Manju. Having said that, now to this expert galaxy, why we are here, why we are discussing all this is, we know as this coronavirus pandemic has rapidly swept across the world, inducing a considerable degree of fear, worry, concern in all walks of life, all people around. And to my mind, the most vulnerable, as we are seeing right now all around us, the most vulnerable group right now, which I feel are the healthcare workers, especially the frontliners. May it not be frontliners, still the healthcare workers who are being approached left and right by people, patients, family members, associates, acquaintances for want of help, for want of, what to be done, what can be done, what will happen. So all these things add on to the already pressurized healthcare workers. They've been working long hours in this vulnerable state. And, in addition to the exposure to the trauma of patients and agonies of maybe life members and next of kins, they are, they also face moral dilemmas in my mind, because this disease is something in which there was hardly any experience when we faced it first in the last wave. And now there are more mutants and more new things to be added onto it. So it's an ever-changing thing every day. And in this context, we thought, let us think about the healthcare workers as well. So to my mind, dealing with the dual responsibility, healthcare workers should be able to recognize that whether at all this agony, fear, stress is actually a mental issue or not. So let us have a deeper insight and how we can deal with these challenges while talking to all our experts. So I'll probably start with the epidemiologist to know the the burden, what we are facing, how big is the impact, and how much should we know about the mental health issues. So over to you, Dr. Jugal. I would like to know that what exactly is the burden of mental illness, which you have come across or which is available in literature in healthcare workers, and also if at all we can recognize what are the risk factors, which lead them to develop these mental health disorders. So over to you, sir.
Thank you. Thank you, Monika. Thank you for inviting me, particularly this Association of Obstetric and Gynecology. Occupational health is my favorite. So unfortunately, it's come out in my mind. Thank you, Jackson Pal. They are associated with us for many other webinars, and the frontline leader of our senior Dr. Grewal, who is always supporting and always recognizing MEMCOs. So I feel honored. Dr. Kamal Bakshi is there. She was there in our AIMS when I was doing post-graduation there. Achla Batra and my own colleague of the Maulana Jad, Pankaj is there, and everybody's there. Anu is recently become part of our adolescent health, and she's very energetic, and we are going to work more. When you said about healthcare worker and COVID, actually, when it comes healthcare worker, we feel that maybe I think ASHA worker or maybe, A&M or maybe something like that, it comes in healthcare worker. But actually, WHO defined healthcare worker, is more broader than that. We have the professional and non-professional group comes under healthcare worker. And in that, we have doctors and also, non-professional people who are working in hospital and health setting. They are also part of it. Even electricians working in hospital are healthcare workers, but unfortunately, we do not recognize. The people who are looking after our laundry and all these things are also healthcare workers. So we have a very big group. I'll show some of my slides just to, impress, my talks. Actually, when we talk about this COVID, we all know it's started from Wuhan, and in a few months, it was all around, and 219 countries, involved in it. So whole world is at its feet. The COVID has won this. But as Kamal Bakshi has said, we have, we have that, power that any such kind of calamity is never destroy us. And we have seen hundreds of pandemics in the history of mankind. So this will also go, and we know how to deal with. Maybe I think some mistake would be there. When we talk about this COVID, then we'll say that this number, although appear crores, but they are much less as compared to when we talk about Black Deaths or, maybe I think plague and some other, even Spanish flu, where 1/3 or 2/3 of the population, you can see that of the world was affected and many million people died. So we have not reached to that level. And we are not going to reach to that level. At least we have many strategy which can look after. Now this population, we like if you talk about India, we are around 17% of the total population. So the total case in the world is 16 crores and we have 2.5 crores. So it's come out to be 15%. So our population is representing the world. But what is most interesting is that the death is less, as we compare the whole world. So our death is definitely less. Maybe we can say because of our structure of the population, we are younger population where it is not as fatal as it was there in Italy or some other country. But when we talk about mental health, because today is the mental health. So first of all, we should know what is mental health. Although DSM-5 has defined differently, but I'll take the definition of WHO. That says that actually it's a integral component of health, as Dr. Grewal has said, that we have the mental health and physical health and social health. So it's individual, but when we talk, in a public health, then it is beyond individual. But when we talk about individual, it's a person realize his or her own, cognitive ability, effective and rational, abilities. That's a very difficult one. The most important definition which I found is actually, this is given by, Surgeon General of, mental health. It is from USA. They said that it's a state of successful performance of mental functions, resulting in productive activities, fulfilling relationship with other people, and ability to adopt a change or to cope with the adversity. That's a very interesting one, an important one. So whenever there is an adversity like this one, calamity, are we able to cope up? if people who have not coped up, I think they may suffer from. And every time we are listening, no, everybody is having mental problems, like Sir has also said, that 25% and 75%, not true. It's not true at all. So in true sense, we'll find that how many are actually suffering from. So we have different groups, and we have a tremendous pressure. Everybody knows the pressure of, personal safety, the loved one safety, and the shortage of equipment, ventilator, protective gears. These are all, safety issues which are always, giving rise some kind of fear in you. And then you are involved in testing and, screening, quarantine, isolation, treatment. And our workers like the ANM and ASHA workers are going to tracing, contact tracing house to house. So there, I'll tell you that in many of the states, they were not going because of the fear that, that is why most of the time we don't have very good contact tracing, because it's a fearful that how you can go to a patient's house, without any protective gears. And many a time in the beginning, it was not there to everybody. So we have conducted a survey and we found very interesting result. This was a cross-sectional study. It is published one, and it is online survey. And the people involved in it is 478. So we have asked about the depression, because the depression is the first symptom which is there because of the stress. And so we found, very high number of people were having mild, moderate, and severe depression, and we have used the patient PHQ, that's a patient health questionnaire 9. And what we have found out that the fear, worries, old age were significantly associated with the severity of the, depression. And the percentage of depression was almost 51%. You can see that not everybody have the depression, but the 51 is a huge number. And then when we asked one question, who felt depressed? So almost 28% said that they are feeling depressed, although the number of depression is quite high in people, and they themselves has not realized that they are depressed. But when we ask why, what are the reason of your feeling depressed? And the most significant finding was that, they have the fear of corona and lockdown. These two were the major issue. Beside that, we have many, like about family and helplessness and alone, jobless. These all things were there, but the fear of corona was, was huge. And you have reason why we have the fear of corona. Although we keep saying, no, it's flu-like, but it was not like this. We have other scientists in the world have said, and this is the most important paper by one of the, authors. He has reviewed 59 papers and said that odds ratio of, when we compare the people who are actually having the, people who are actually having the corona exposure and people and those who do not have, or those who have the high risk and those do not have the risk. So the post-traumatic and acute and post-traumatic stress was almost, odds ratio was 1.7. So there was 70%, risk was increased in the people who are having the higher risk. So that's what is a picture of when we talk about this post-traumatic stress in the COVID. And they said that longer quarantine, lack of practical support, stigma, they were the contributor of the, this kind of stress, post-traumatic stress syndrome. The clear communication, access to adequate personal protection and adequate rest, both practical and psychological support. These are the suggestions, come out from this study, which is actually a meta-analysis. So this study is very strong, saying that these are very important things, and the clear communication is really lacking in most of our working place. Another study from the Wuhan said that 50%, which is equal to our study, that is 50% depression, 44% anxiety, and 34% insomnia, 71% were distress. And the study population was quite high, 1,257. So that shows, we have different varieties of the mental distress or mental, disorders which were there. another study from our, India, which again shows 34% depressed and anxiety and stress. Again, it shows almost 1/3 of the population is having problem. This is the another study which is again showing, overall our health workers with symptom of anxiety, depression, and insomnia. So insomnia, depression, anxiety is the most common one found in our workers. This is a commission study by ICMR, and I am part of it. It is actually mental health and social stigma among healthcare workers who are involved in management of the COVID, and various group of workers were taken. Now you can see that we have, emotional exhaustion, although the questionnaire has different segment, and one of the segment is emotional exhaustion, which lead to so many problems. And there are, various items in it. You can see that, this gray and the green color. So that shows almost 20% of all the, areas have sometime or always have a problem of, facing the emotional exhaustions. So we have physical exhaustion, we have, looking after the self, and all these things were there. So it shows in the country, it's a whole India study. That is why it's more representing of the country. So emotional exhaustions occur in our, healthcare workers quite high. Then, this is the finding which shows depression, anxiety, and stress in healthcare workers, and number was less. Maybe I think it was actually carried out during the period of November, December, January. That is why a little less was there. But when we talk about today, then the number would be much higher as compared to what we have seen. These are different other disorders which are, shown. That is a burnout in occupational, because it's an occupational disease. When we talk about this healthcare workers having the mental disorder, actually it's an occupational problem. So burnout is also one of the biggest problem, and which is, leading to so many other mental disorders. Loss of appetite, frustration, anger, these are all there, and confusion is also there, which could be because of, again, lot of confusion because of, again, non-clear communication between. So what are the risk factors, as Monika was talking about, that, if we can focus on some of the risk factors. So these are risk factors. One is the rising number of patients. So when we have the graph going up, and every day we are seeing in the newspaper, then every healthcare worker, have a problem. Long hours, long working hours, and limited personal protective equipment. Initially, if you remember, we don't have the PPE, and it was really horrifying. But later on in the June, July, when the temperature was high, you have to wear that PPE, and there was no AC in those. I can remember in my Southern hospital where the AC was not working. Not working means like it was closed down because of we don't have understanding that how this virus is going to be circulated. Then next is a financial uncertainty. So we have large number of people who are actually on the contract and also uncertified or uncertain job. Then this create a lot of problem. Like in our case of class 4 employee, that's sweeping class. When recently we have changed the service provider. So all these hundreds of our class 4 employee were having a lot of stress. I have interaction with our cleaners and the sweepers and all these people. The orderly were also in the same group. Then misconceptions, and every day we are finding the misconceptions creating a lot of fear and confusion, and that is why we have a lot of stress. So misinformation, misconception in general population, and you have to deal with them. So if you see all the time, that a person who is having a lot of stress, lot of misinformed person, you become anxious and sometimes you stressed out. Then stressful working condition, no time to eat or sleep. That's also one of the reason. Then increasing workload with increasing number of suspected and confirmed cases. Many times patient comes and we don't know whether it's a positive or a negative. So you are in dilemma whether we should consider it is a positive or not. And the test comes, maybe after one day or maybe 24 hours, 20 or 48 hours. Then depleted workforce is also a become problem. Like, in our hospital, this resident group, they didn't join. Even the SR didn't join. In many of the departments, we didn't have the SRs, and they were not coming forward to join because they were afraid of, because their parents were not allowing. So we had a depleted, workforce, and leading to, again, a problem. Intense scrutiny of social media. That's a very, very difficult task. I don't know how to deal with. Maybe I think we can have another session on social media. Isolation from family and social support. That's also a problem. Fear of transmitting virus to family and others is also a big, risk factor, which is leading to stress, because you have the older, mother and father, or maybe a small child. So you have so much stress. Then hostility and aggressive toward medical personnel, so much stress. And seeing the videos that, doctors and nurses were beaten up, and all this has created a lot of stress. Helplessness due to lack of effective treatment. All of you know that, we are not able to treat the patient, although, the oxygen supply later on added up, it is not available. So we want to treat, but supply is not there. So these all lead to, so much stress and so much, all factors leading to mental health problems. So with these words, I think I'll stop it, because how to deal with, how we can handle all this will be taken up by, other panelists. So thank you very much for allowing me to speak on this topic.
Thank you, sir. So it was a very, nicely summated and a comprehensive epidemiological aspect of the mental health disorders. And just in the same flow, with the same flavor carrying on, I would quickly like to invite in Dr. Pankaj right here, because, you've introduced these terms of burnout, stress, and all these anxiety, fear. So Dr. Pankaj, what is the impact of these things on, in your practice, or what you have come across on various sectors of, as sir said, that healthcare workers, not just doctors. So in your experience, what have you seen, that what is the impact on various sectors of various groups of healthcare workers, and what is the exact impact on their health as a mental health specialist? I would like to know your views. And at the same time, I would like to ask one very pertinent question. Is it all bad everywhere, or, do we have some takeaways from this situation? Please, sir, Dr. Pankaj.
Thank you, Dr. Monika. First of all, I would like to thank AOGD, Dr. Achla Batra, for inviting me for this session. I would also like to thank Jackson Pal company for organizing this wonderful webinar. I would like to start with what Dr. Buckshee ma'am said. Good evening, ma'am.
Good evening.
We need your enthusiasm to fight COVID-19. Yes, ma'am, nari hogi to himmat hogi, or himmat hogi that we can fight COVID. So definitely your words are true, that nari hogi to hi hoga, because you are the mentally superior persons, female. This is worldwide known that females are mentally superior to the males. So yes, ma'am, we need lots and lots more of females to fight the COVID, and your guidance will always help. Thank you, ma'am. Coming to Dr. Grewal, sir. Good evening, sir. As you said, with originality comes a sense of responsibility. Today, we all have to be responsible in day out fight against COVID. So what I personally do, at least I try to teach 3 to 4 people how to wear mask. I personally put the mask on their faces and pinch the wire so that they should be aware how to wear it. So we know this is a fight which we all have to fight together. This cannot be won individually. Before me, Dr. Jugal Kishore, sir, has wonderfully explained the impact of this COVID on the mental health. Sir has deliberately, I don't know, he has avoided one thing to share, that he is PhD in psychiatry. So he's as good as a psychiatrist, as good as epidemiologist. So he's a
That
very
showed
learned
in his
person.
presentation as well.
So he's a very good epidemiologist and a psychiatrist. He rightly said, what is happening is there is a lack of clear communication. Lack of clear communication where? Lack of clear communication from the authorities to the doctors, from the doctors to the patient. Very minor thing. Patient admitted in an ICU, doctors are communicating that yes, patient is getting benefit, but there is no way to the attendant to know whether the patient is actually okay or not. In our setup, we are trying that patient should communicate with the attendant through mobile phone. But then there are centers where they are not even allowing the mobile phones. And these kind of things, they create doubt. Sir also spoke about the social media. See, it's a very, very important and a very relevant thing. Social media, if they continue showing about the deaths and all those negative things, this will lead to insecurity among the patients. There was a wonderful study where it showed that the bridge which you are seeing behind me, that the Golden Gate Bridge, was a focus of suicide, and people were reporting suicide regularly, that this is a bridge, and they were jumping out of it. So the psychiatrists of the areas, they met and they requested the media not to report about the suicide, and you'll be surprised, within a month's time there was no suicide from the very bridge, the Golden Gate Bridge. So they have a very big responsibility, and it is not that we psychiatrists are just saying for sake of saying. I have a document here with me which says that on 28th of April 2021, the IPS, Indian Psychiatric Society, and the senior people from the subject, they have issued an open letter to the media that not to report mass burning cremation grounds, relatives diseased, wailing inconsolably. So they wanted not to show this. Yes, to show certain amount of information is okay, but if you keep on doing this 24 hours, it is not going to help. See, we all know what COVID did in last 1 year. There was a loss of livelihood, loss of life, loss of routine, loss of independence, confinement to the home. People were unsure about the treatment. This was one of the biggest fear, unsure about the treatment and the insecurity. Whether if they get this illness, what will happen? Then there was a loss of interaction. People are confined, they were not able to communicate, which resulted in increased health problems. And in our cases, psychiatric cases, there were very much relapses because patient could not come to the doctor, and there were very huge amount of relapses were seen. Now, coming to another point before I come to the positive aspect, how can we identify the illness? How do we know that we are suffering from the illness, mental illness? Because mental illness can be invisible. You can have anxiety, but you still can be confident. You can have depression, but you still smile and make jokes. You can feel suicidal, but you still turn up to work every day and appears to be fine. So this does not mean that you don't have psychiatric illness, that you are feeling confident, so you cannot have anxiety. Yes, you can have anxiety. At the same time, when you are feeling confident, It is on the later part that your confidence goes down. You can still enjoy jokes when you are having depression, but at the later end, when it is very severe, you'll stop enjoying those things. How to identify? The point is how to identify. See, identification is first thing. People ask what is normal and what is the difference between an illness. There is a very thin line between normalcy and illness. You can feel sad. आप fail हो गए हैं, you can feel sad. But you will feel sad for 1 or 2 days. But if you are feeling sad for 7 days, you might have illness. Okay. If you have lost somebody near and dear one, you can grieve for 7 days, 14 days. But if it is going beyond 1 month, then there is a problem. And what is happening these days? The cycle is continuing so fast that we don't have time to recuperate, which is very important. So who is the first person to understand that you are having illness? You yourself is the first person. Once you start having doubt whether I need a psychiatrist's help or not, that is the point. Because before that you have not even doubted yourself. So that is the point. You should seek help from a psychiatrist. Do not delay, because delaying will making it more troublesome. Okay, so do not delay. The moment you feel, or anybody who's near and dear to you, if they say, okay, let's see a psychiatrist or let's see somebody's help or psychologist's help, mark their words. You need help, just go there and look for a help somehow. Okay. Now coming to I would like to discuss about 2 more problems. One is problem in elderly, and another is problem in children and adolescents, but it will be later on. Now coming to the benefits, it is not all bad about COVID. The benefits of COVID, the nature got the chance to recuperating. There was less of pollution. There was more of a blue sky. The animals returning and reclaiming the land. As you must have witnessed last year, Nilgai was roaming on Noida's roads. Then there were some social benefits. Like people are now more aware about their social duties than their rights. People are coming out to help each other. People are from their real life to real life, like Sonu Sood and many others. They're trying to come and help. People are generating funds. 1 year back, when somebody would ask for donation, you would not have donated. But mind it, around only the government servants, they have donated more than 30,000 crores in their salary terms. So we are generating and we are not complaining. So this generation of funds are there. People like doctors, policemen, sweepers, NGOs, they are doing day in and day out their duties. But apart from them, general public, there were 2 sick brothers. They were doing cremations for all those who have died because of corona, where their own relatives are afraid to cremate. Then there were cultural benefits, like everybody knows Namaste is back. Washing hands and legs before when we return to our home. And this was the time when the elderlies have time and opportunity to share their cultural values with their younger ones, which in today's world was totally impossible, almost impossible. Then there is a technological improvement. There's like DRDO recently has come up with the 2DG medication. Last year they came up with the UV lamp, which can directly kill the virus. Then people have made H-card automated robot. Then the people from IIT, they have made Rudra, the oxygen concentrator. Then there were economic benefits. People were, you'll be surprised to know, in last 1 year, there were 30 more multi-billionaires in India than the previous year's this thing. So we were able to generate, I would say, jobs, but in a different sector, like PPE kit, mask, and so on. Then there were personal benefits. You could not take break when you were working. So people from software who were working day in and day out, now they are working from home, or they are, I know a few people who have went to Uttarakhand and they have hired a house for a month or so, and they're working from that place. This kind of break, which they could not take earlier, now they're spending more times. Recently, one of my friends from UK said, my 2 sons are now more pally because they get to spend time more. Otherwise, they were not even in talking terms. So these personal achievements, which are there, now you can have a family dinner, which most of us were not able to have. So these more interactions between the families and see, now there are family cooking time. They are playing caroms and ludos, which were almost obsolete. Now they are back into the picture. So you cannot say that we have not gained anything out of this. Yes, we have gained the closeness. We have learned that yes, we can stay without going out. We can still survive within the means which we have. So it is not all bad. Yes, it is bad. It is very bad. But still, those casual laborers who are working in the cities, now they are back. Before the second wave, they were very happy working at their villages. But unfortunately, the second wave has reached the villages also. So the impact of second wave is taking its toll. But before that, they were meaningfully employed at their own district or at their village level, and they were contributing to the society. So it is not that it is all bad for COVID. Rest, there are things which we'll discuss later on, like the grief and all things.
Yes, sir.
Once everybody.
Nice, sir. I mean, it's very nice of you to have brought out. Definitely, you know, we need to have some positives also, rather than just concentrating on all bad news all around and all. And one very pertinent thing which I could get from your deliberation was that we really need to recognize when we ourselves are getting affected by all this, you know, that thin line which you talked about. I wish you could go on elaborating on that, because I'm sure even amongst the people present in this forum also must be wanting to very kindly know where is that thin line, where do I cross that thin line and when not. So thank you, sir, for bringing that out, and I'm sure we'll build this on. And to continue the practical aspects forward, having known that what all can be the you know, the mental health issues, let's see, having I mean, with these existing issues, with the healthcare workers to handle them at administrative level, I will now call in Dr. Manju Puri, to just briefly tell us that, you know, as an administrator, as a obstetrician and gynecologist, as a senior faculty, as a teacher, what all issues she's facing on the ground level, managing her department, the various sectors of her department ably, you know, considering their, you know, first of all, leave issues. And once somebody gets affected, definitely then you are short of staff, how to manage them practically, and what all innovations, or what are your thoughts on personally facing the challenge of this COVID infection, getting protected, and of course managing your team. Ma'am, please.
Thank you, Monika. I was actually surprised at the invitation when it was extended to me by Dr. Achla, because I thought neither am I a trained administrator. nor am I, any qualified person as far as this particular aspect is concerned. But anyway, I can only share my, experiences. I took over as HOD on 6th of May, and that is when last year, and that is when actually COVID started. So it's been a very interesting journey, challenging, interesting, but very satisfying. So that is how the journey has been. So Dr. Jugal and Dr. Pankaj have very nicely highlighted all the problems. And when I was listening through those conversations, I was actually kind of reliving and trying to understand as to, what we did was probably, correct identification and correct problem resolution. So the only qualification, I think, or what supported me is one, that I have been staying with a psychiatrist for the past 35 years. I have a husband who is a psychiatrist. That's one.
That's another credit to you, ma'am.
And second is that, I have a good background of QI, thanks to Aparna, who's my QI buddy. So we both are working, and it is QI which really, really helped me. And the third thing is I do follow Sister Shivani. So I definitely would, give credit to her, to my husband, and to Aparna for my QI background. So these three things were what actually helped me, to organize things. So as head of the department, I had a lot of priorities. My first priority was my patients, who we all know that they were going from one place to another. The second priority was all my juniors, my residents, my nurses, and my workers all together, because I knew that in case we were not working together as a team, we are bound to fail. So it was trying to balance between all these three levels, and then my colleagues. So there were problems at each of these levels, but I tried to break all the problems in small pieces, and we did not allow the problems to overwhelm us. So every problem, it was early identification of problem and resolution by a team, and with everyone concerned in that problem participating in the solution. So it was not I who was trying to solve the problems. I just helped them. I just gave them support to come back with a solution of that problem. And that is how I think probably everything went on smooth. So to give an example, right from the senior level, so when I took over, there was so much of hesitancy, and rightfully so, in the consultants to go and take the rounds in the red area, because they had elderly parents at home, they had children at home, so everyone was worried. So and we as seniors were probably asking them to go and do the take the rounds. So there was a lot of conflict. I remember we had a meeting. So then quietly, after that meeting, I donned my PPE and I went and took a tour round. And believe me, after that, we have never had any problem. All the department has been working. It is that initial, scare, the fear, and every individual has got a different, approach or different reaction to, anxiety and stresses. So each one take their own time. So every individual is different. So we need to understand we can't have the same rules and regulations for everyone around. So we have to give them time and let them, some would come up immediately, others would take a bit of time. So I think that is one thing which we, as a administrator, you need to appreciate, that everyone has got their own strengths and weaknesses, and we are not supposed to bring out their weaknesses. We are supposed to, take out their strengths. So that was point number one. Then if you come to the residents were never a problem that way. I'm to say, I think they never had a choice. So you asked them to do the work, they did. And a lot of them got infected. So we built up a buddy system in them. So, they were not wearing their mask and caps. So we made them, I told them that one would help the other one to look up, ki usne nahi pehna to wo usko bolega. So a buddy system was created between them. So that was another thing. Then my morning meetings, I did about half an hour, 45 minutes every day, ever since that day. Our department, we have been doing a morning meeting. If I am there, I do it. Otherwise, Dr. Reena or Dr. Kiran in the hierarchy, the next person takes over. So this is a kind of rule which is being followed. So all the small problems, the outgoing, incoming teams would sit there and they would tell the problems. And then I was absolutely approachable. I've never had, I always, when I thought I would become a HOD, the one thing which I wanted was no one should call the department as toxic. So, you know, that is a new lingo which people use, ki gynae department is toxic. So I wanted to be sure that it is not toxic at all. So that was what was my feeling. And and everyone is happy. I'm to say, I don't find anyone who is unhappy. So the gist of the matter is that people would get together and solve their problem. So they would come to me with problem. The nurses would come to me with problem, and the doctors would come. So I would call all concerned parties and I would tell them that you please solve, tell me the solution, and then we follow it. So then it was their binding to, you know, they were solving their own problems. So I was just a kind of a coordinator, and they were actually taking up things in their own hands and taking it forward. So that was, you know, the journey. And as far as the, you know, we came to the shortage of quarantine was a problem in the first wave. So anyone who would get exposed would go. So we quickly came up with policy. So made 3 people group who would decide on quarantine policy, and that was circulated. So we were very transparent in our approach. So, and, you know, the policy was that these 3 senior people would decide and would take a call. And at the same time, they would counsel them also. So, you know, initially we would quarantine them, but next time again, if they would say that they are not wearing, they were not wearing, you know, they were not protected. So then we would explain them. So there was no dant, dapat, wo kuch nahi tha. It was a very friendly approach. And in the second wave, it was different because, you know, everyone was kind of falling. At one point, we had 35 people who were sick. So I was connecting with each one of them as soon as they would fall sick. And then I lost, you know, the number. Then I made a WhatsApp COVID support group because, you know, I was worried about my residents. So I would connect with them. I would ask them, their parents to connect with me. So, you know, that was another thing which was very, very important. And then I had 2 advantages. One was that I would know if anyone is wanting help, we could extend. You know, I could talk to availability of bed outside. So everyone kind of was there and we were helping out each other. And that group is still there. And secondly, anytime a new, you know, initially the policy was that you would, you know, isolate them for 17 days, then it became 10 days. So I could execute the orders also through that. You know, I was able to connect with them and at the same time, you know, pass on things. We could help each other and we could motivate each other and people would come back faster. So that was another way which, you know, kind of really helped me as far as, you know, getting everyone on board. Then I also blurred the margins of the responsibility. So if the senior residents were not there, then the consultants did, you know, get into the shoes of senior residents. So it was not by force. It was that because they thought this is the only solution. So I was not giving them solutions. So they were looking at it and they were getting into that job. And so that is how the whole thing went. And everyone had been very supportive. And then, you know, there were some people where then, you know, every day I was thinking of new ideas, how to, you know, kind of solve problems. So we would feel that anyone who's not gone home, so to avoid the COVID fatigue. So I started on my own that all those who have not quarantined can go home for 7 to 10 days without official leave. And to say we just gave them a break. Because, you know, at least then they wouldn't feel that they have been working, others have had quarantine, क्योंकि सबका asymptomatic था, सब घर में आराम कर रहे थे. There were very few who were actually sick. So they would have that heartburn कि हम लोग नहीं, you know, that's natural. So, you know, I would send them and we are still following it. So वो जो 35 का group था, तो उसमें I would know this one is coming back. So I had Dr. Anuradha, who was very meticulously managing all the senior residents and junior residents. So everyone, it was a collective, it was not me. It was collective, you know, thing, and it is still ongoing. And it has been an amazing, amazing journey. Lots of learnings, lot of bonding. So for me, I think it was wonderful. So basically, that was what my journey was. Yeah. So thanks.
You spoke like a true leader, ma'am, and a true administrator. Yeah, ma'am, this is sure. It's very right that without, as you said, leading from the front, taking all together, you know, caring about their miseries, because not all people are same. And you very rightly pointed out support system, which is a very important functioning of any department, so to say, or an institute to work. Because if somebody is leading from front and able to solve their queries and cater to each and everybody's this thing, then even healthcare workers feel that yes, we are part of the system, and let's now work more for the patient care and all.
Worked, Monika. I was very particular that they would not return the patients. Initially all those problems did crop up, and then I would also liaise with the HODs of other departments, of other hospitals, that please give us a call, don't send them away. So for me, everything was a priority. We did kind of modify and kept on thinking, doing things out of the box and kind of adjusting. So it was putting different blocks together differently, sometimes one block from this place.
Definitely, ma'am. I mean, and this is the situation which probably each and every head of the department, or so to say, any department would be facing right now in this era. And you rightly pointed out the way to deal with these issues. And thank you, ma'am, for bringing out these things. I'm sure each and every person listening to this solution aspect starts working on this. If he or she is not been working with that.
No, I'm sure everyone is working the same way. Yeah.
So, ma'am, it's good to note that, new things we learned through this bad situation and bad era of COVID as well.
Absolutely.
So continuing the administrative aspect, now just moving on to from slight doctors to the nursing personnel, I would like to call in another Dr. Manju on the panel. Dr. Manjar Chagani, what in your opinion the nursing personnel issues which you faced, and as we keep saying left and right, shortage of personnel, shortage of issues, equipments, even lack of support, and in these times we are not even allowing a caregiver by the side of the patient, affected patient, and at this time the nursing personnel is the frontliner for that care. Of course, we can give directions, we can help the treatment part, but the actual, I would definitely say, actual caregiver at that point of time would be a nursing personnel. And so to say, the further the Group C and Group D employees which you are handling as well. So please let me know that what were the practical aspects of the problems, the challenges you faced, and how you dealt with them in the previous wave and now, very shortly, so that now we can move on to remedies.
Yeah. Thank you so much for inviting me for this. AOGD, Dr. Achla, Dr. Monika, and all stalwarts sitting here. Thank you so much for giving me this opportunity. As we know that there's significant uncertainty for all healthcare providers, and key decision makers are finding it difficult, challenging to navigate through the solutions. And same was with nursing also. And in fact, I'm dealing with paramedical staff also. But I would say, as Dr. Manju just now described so nicely, that the things which they were facing, the challenges, I think in all categories of, with all categories of health workers, we are facing almost same. But in nursing specifically, I would say that shortage of manpower, like for example, 1:6 is in general ward, 1:1 in ICU otherwise. Now we ask them to manage even the 20 patients sometimes, 1:20 in first wave, and now also, in fact, last 15 days, now it has come little lower numbers. So it's fine now, but they have looked after so many patients, keeping all norms aside. And the second factor which we have faced is that the staff is getting so exhausted because of the long duty hours, especially in private hospitals. We have asked them to stay back for some time because others are quarantined or are suffering from this COVID, and they're not able to come. Their shift is marked. Their duty is there in roster, but they're not able to come suddenly. So we had to ask the staff who is on duty to continue. And with all those things, in addition to this, not only number and doing a lot of things and uncertainty in roster of the staff, there are no attendants. Earlier for feeding, for helping them in hygiene, position changing and other things. There are relatives or attendants available, but here there are none, and there are no attendants available for care. Also, they are waiting outside and they're very restless. They're very restless for news or the update about the patient. Now the staff is finding it too difficult to deal with this shortage, to deal with all kind of work which even she was sharing with attendants and other people. Now she has to do that. In addition to that, she has to give information. If she is not giving, the patient's relatives are becoming violent also many times. And there are incidences, many incidences which has happened like that. And there are issues with the PPE also. Initially there were no supply of PPE. So there was dharna kind of thing by the staff also. There are no PPEs. Later on, now we have PPE, but the quality is also important in PPE. All PPE are not of same quality. So that is also one issue. Wearing PPE, the problem which they face is that for 6 hours or maybe 3-4 hours, they are not able to go to washroom also, which is a problem which is not so much given attention by other people, but it's really a problem which I have faced. They're not able to go to washroom for these many hours, and then they are having dehydration. They're not able to drink because we have not made any arrangements for their diet plan, or like in countries, we have seen other countries, they have a diet plan, they have a break plan, they have all those things. But here we have faced that the nutrition part was really adversely affected. Their kidney function test, many of them have got their kidney function test altered because of this problem of dehydration. They're not going to, and had also the urinary tract infections. Many of them had, because of the problem that they're not drinking. They're not drinking because they had to otherwise go to the washroom. So they can't remove their PPE again and again. Once they are in for at least 3-4 hours continuously. So not only these problems, but inadequate supplies like oxygen in between was a really
very true,
heart-touching, and was a experience which many of them have cried and expressed that they have this problem, but they can't help the patients or the relatives crying outside. So these are the problems. Also the financial crisis in private hospitals. They are not getting handsome salaries. Let me admit that very candidly, that they are not getting very handsome package. So and many of their family members have lost job. Like many of the staff told me that their husbands are not working, they have lost their job. So they had all these kind of problems. And also I will tell you that these are the physical which I have talked, but mental is I think more than what physical is doing. They have fear of uncertainty, fear of infecting family members. Because of that, they have feeling of guilt. Then this thing, all these things are leading to anxiety, depression, insomnia. And there are people who have approached psychiatrists. They needed psychiatric help. And it's good that we were able to identify that line. There's a line which decides, as Dr.
Pankaj mentions. Yes.
Yeah, we were able to do that, and many of our staff got treatment and counseling sessions, because before going into the syndrome, if we send them for counseling, I think it is helpful. And also one more which people may not observe closely, that because of PPE and wearing these goggles, they were finding it too difficult to find the IV line. because your vision gets little occluded. It's
and it gets
little
fogged
blurry.
also at times. Yes.
Yeah, fog also. So they told me that it's a real problem that they're not able to find the IV for cannulation. They find it difficult, and once they do it also, or if they do it twice or thrice, they feel guilty that why they have done this.
This adds on to the stress of non-performance,
Yeah,
performance guilt and all.
Yeah, that led to the this thing that they are not able to perform their duty efficiently. So that also added further as a stressor. Apart from other stresses, this also which I did not actually realized. They reported this, and then I realized, yes, these are actually really problems for them, because of which they are having further stressors and problems. So we'll
thank you,
come
Dr. Manju.
later.
Yeah, thank you. Because, having talked to you and Dr. Manju Puri, I mean, we have kind of reiterated that what all risk factors, what Dr. Jugal brought out, and what were kind of, envisaged again by Dr. Pankaj, they are actually being faced by us, and we're seeing that happening in front of our eyes. And you both as administrators must have definitely seen people reporting these things to you. So you mentioned very nicely a word of counseling and having identified that thin line. So here comes in the role of two other experts present here with us, whom I would probably jointly or one by one invite. Dr. Poonam, she's the expert with us from UK. I mean, she's otherwise an ophthalmologist, and on top of it, she is teaching meditation and she's helping her colleagues, juniors, to practice that and inculcate within their work routine. So I would especially want her to tell us that how she's been managing that. Seeing all this, I'm sure the situation would be more or less the similar, in the UK as well. Because very recently, even I had the opportunity to work in UK. Yes, definitely there is a systematized way of working there. But during this COVID, practically each and every person felt helpless in those times. I'm sure you must have come a long way since then. But how have you been helping the healthcare workers, ma'am, if I may ask you?
Thank you, Monika, for the question. And thank you, Achla, for giving me this opportunity to be here today. So essentially, I'm an ophthalmologist, but I have a very long-term association with meditation and awareness and insightfulness. So what I have been telling my trainees and those around me is to bring their attention to the breath. In India, we talk a lot about pranayama, and that's fantastic, but that requires time and space. But bringing yourself to the breath takes literally a few seconds, and your breath is with you all the time. So when people are getting overwhelmed, and there's a lot of traumatic stress, the trainees, the consultants, especially those in busy wards, are facing huge amounts of time consumption with COVID, but it's around the trauma of dealing with patients who are dying, their relatives, and having then no space to grieve for anybody around you. Because even as a physician who's dealing with multiple people and staff who are undergoing stress, it's quite a difficult situation. So what I've been telling people is to bring their attention to the breath. What we cannot control is the realization that there are certain things we will not be able to control. So with all the new things which are coming in with COVID, we are bringing in lots of treatments, but the reality on the ground is that there's still a lot of uncertainty, especially with the new variants coming out all the time. So coming back to, because the time is short, I'll keep it very succinct. What I've been saying to people is when you realize that you're stressed, bring your attention to your breath, stay on the breath, and whatever the thought, accept that there are certain thoughts, but breathe in and out, staying focused on the breath, observing the breath as it goes into the lungs and realizing the opening and closing of the lungs. So if actually people want to engage in this for just a couple of minutes, I'll demonstrate it, because it will be really easy to see how we can do it even with 1 minute at hand. So just as you are here, bring your attention to the tip of your nose and notice how the breath goes up the nose, and then allowing the breath to spread into your lungs. And if you notice that there's a thought in your head, just letting the thought be whilst staying focused on the breath and noticing the opening and closing of your chest. Just breathing in and out, and then bringing your attention to the rising and falling of your belly. Just staying with the breath and imagining the breath flowing through you from the top of your head to the tips of your toes. Just staying with the breath and letting any tightness or tension that's there in the body dissolve with this breath. Imagining the breath flowing through you. And this doesn't take long because you are with your breath. And as you breathe in and out, just notice where the tightness is and then letting it go. So this practice, which is called mindful awareness, is essentially about staying attentive in the present moment to whatever it is that is happening. So we cannot change what is in front of us. We cannot change the unfolding of the events as they're arising, because there's so much trauma, so much disease, heartache. And as it has been happening in India, the negative press, the absence of oxygen, we cannot change that immediately. But what we can do is attend to our own psychological need in the moment and ground ourselves. Because when we are overwhelmed, we cannot deal with the situation effectively. So if we want to be more productive, just focusing on about 5 breaths will ground us, will center us, give us the space in our mind to think of a strategy to go forward. So it's about creating that space, about understanding the stress. And you know what, a lot of people have been talking about stress and about recognition of stress. What I would say
that is very important.
What I would say is that most people stay in their head and in the thoughts, and even the stress is felt in the thoughts. So the thought keeps going round and round in the head, and they don't realize that they are stressed until sometimes it's too late. The recognition of stress comes from our awareness that there are events which are happening around us, which are causing a reaction in the body. And it's essentially that reaction is led by our sympathetic system, because it's a fight or flight reaction. Whenever the body feels that there is a threat to our survival, sometimes the threat isn't actually our survival, it's about the situations we are facing. But the human body, the system recognizes it as a threat to us. And our amygdala then sends the messages to the brain, to the hippocampus, which starts the sympathetic reaction. And the sympathetic reaction is felt by different people in different parts of the body. Some people will feel it as a tightness in their chest. Others will feel a tightness in the scalp muscles. Some will have pain in their shoulders or in the back, lower back, or a queasiness in the stomach. The clue is in recognizing where it is that you're beginning to feel it. And as soon as you feel it, you come to the breath, take a few breaths, because what that is doing, that slow breathing, deep breathing, is activating your vagal nerve. So it's activating your parasympathetic system. And that is just the balance, you know, the Sushmana, which we talk about, that is the balance between your sympathetic and parasympathetic. So bringing that balance so it's really scientific. There isn't any kind of esoteric practice. It's a very scientific practice where you're activating your parasympathetic to calm yourself, to give your brain a space to think, allowing your executive function from the prefrontal lobe to take over. So that is what I'm essentially telling. And also when we are seeing patient after patient we feel overwhelmed and we are not giving ourselves the space. And there is a very famous Buddhist saying which says you cannot pour from an empty cup. So if your cup is empty and you try to pour from it, you can't. If you aren't looking after yourselves, you aren't showing compassion to yourself, a time will come when you'll be so fatigued that you'll not be able to extend that empathy, that compassion to your patients, to your colleagues. So it's important to have that self-care component in place before looking after others. You know, it's like when you go in an airplane, they say, take the oxygen mask first yourself.
And then,
because otherwise you'll have no oxygen left for yourself and then you'll not be able to help anyone else. So it really is about looking after yourself so that you can help to look after others, and recognizing, having that early recognition as to the times come where I need help, and having that community of people that you can turn to. If you are that tired and that fatigued, there will be somebody. If you have a community, like it was really elegantly demonstrated by Dr. Manju Puri, that the community she's created is that compassionate community, which is extending a helping hand to everyone. You know, she's letting people go early before they become fatigued. And then they're feeling, okay, you know what? She's doing it for us. So they'll return it tenfold. So having that feeling for yourself, because then you can extend it to others. And Achla said at the very beginning about how our cells feel it. So if you look at the human body is made of billions of cells, trillions, I think 70 trillion cells. And if one cell becomes not dysfunctional, slowly it has an impact on every part of the body. So stress starts physically and then becomes a mental problem. So if we catch stress when it's still a physical issue, it hopefully won't go to the point where it becomes a mental challenge.
Thank you, ma'am. Thank you. I mean, you know, nothing better simile like what you gave. And thanks for telling that importance of self-care and self-compassion, which you believe in and which you have been advocating. I'm sure there would be many of your colleagues and juniors or otherwise who would come back to you saying that they are a better person, they're feeling relieved. So thanks for that insight. And just carrying this flavor forward, you said, you know, when we are able to recognize that, yes, we are stressed out and we are practicing these things learned from experts like you, then there may be a point that we may feel that this is not enough, or maybe, you know, some things are not fitting into picture. There is something wrong. We are somewhere or the other, we're not able to handle maybe the queries from here, there, and whatnot. There must be a few people who are not able to manage at this level of that self-awareness. So at this point comes the importance of people like Dr. Pankaj and Anu, you know, whom we approach for counseling, and maybe for those who recognize that, yes, there is a need and we need to approach people, we need to seek help. That is the time when people like Dr. Pankaj and Anu come in. So now comes the role of Anu, and I'm sure, leave aside healthcare workers, you must already be bombarded with so many questions left and right, with all kind of people around. And so to say that I've heard that people are not as of now satisfied with what is happening in this wave. They are bothered now what will happen in the third wave, which is nowhere yet to be talked about or seen. So, you know, in this scenario, how are you dealing with things, and what would you suggest specifically for us healthcare workers to put our best forward? Please, Anu.
Thank you so much, Dr. Monika Gupta, for having that wonderful chat with me in the morning, and Dr. Jugal Kishore for actually having me on this panel. So I really feel, it's amazing. First thing, it was like, it's like this, I'm like, oh God, look at all of you doctors. And I'm like, what am I going to say? And I said, okay, I'm just going to share my experiences and how it has been so far. And being in this mental health space for over, I guess, 12 years now, okay, I guess finally I'm valuing myself more, because now is when we are getting bombarded with things, especially since last March. And yes, like you very rightly pointed out, and each one of us is talking about stress. Now, people are worried about कि first wave nahi, second wave की बात नहीं करनी है, अब लोग मुझे फोन करके पूछते हैं कि थर्ड वेव में क्या होगा. I said I'm not the Jyotishi. I have no clue, and I'm not going to worry about it, because for me, and like what Dr. Poonam also was saying, and Dr. Pankaj also was saying, because we're dealing with similar things. It's about the now, the here and the now. We're either living in the past or we're worried something about the future, and we have absolutely no control over it, right? And for me, I'm delighted because serving healthcare workers for me is like, I mean, in the morning I was sharing that if I get an opportunity to be of some service to people who are tirelessly serving us, and like I think Dr. Manju also was saying, you know, sitting in those PP kits here, and here I was just thinking about, itni garmi ho rahi hai, that I'm sitting in Bangalore, it's not hot, okay? And then the minute she said PP suits, I said, okay, I think I'm in a better space. So why I'm actually saying this is, it's very easy for us, you know, to wake up every morning and think about what is going to go wrong. And the media is bombarding us with statistics that we don't know whether it's even true. Then we have WhatsApp groups. Okay, every day I get added to one group which I have no, you know, no relevance, and everybody is giving their own, you know, nuske. You do this, you put this in the nose, put in the. I mean, people now don't even realize what is true, what is not, and that is causing anxiety. And this I'm talking about the common people, you know, the ones who we deal with on a daily basis. Then I have doctors, because obviously now they are not in a position to just deal with everything that's going on. I mean, y'all are working overtime, you're burnt out completely. And like I think Dr. Pankaj was saying, the real test is, you know, when you ask yourself, am I burnt out? Am I stressed? That's the point. The answer is absolutely yes, because then you won't be asking. That thought wouldn't have even occurred to you, right? So, which means it is about looking at yourself first and saying, if I am in the best state of mind, only then I can do justice to my profession. And that's how it began for me. Not just I'm talking about that time it was like, you know, a nice profession which was good for me. But when I started dealing very actively since last March, especially with these COVID cases, we would get calls, especially when the minute you say there are pro bono sessions, people are calling in and like crazy. And then you know that if I am not in that state of mind, I cannot do justice to my profession. Then I better, you know, wrap up everything and say ki bas abhi ho gaya mera. So that's when I devised some sort of mind hacks, which is what I want to share with you, with your permission. 5 mind hacks, and it takes me exactly all of 5 minutes in the morning. So nobody has, you know, to say ki, "Arey, mere paas time nahi hai. I have to rush to the hospital." No, just 5 minutes. And that is something like, you know, Dr. Poonam very beautifully said. You can't give, you know, you can't pour from an empty cup, which means you're talking about self-care, self-love, you're talking about compassion. And these are not words that only you know, spiritual leaders talk about. Somehow when we start internalizing them for ourselves and as healthcare workers, each one of you, whether you're, you know, nurses, whether, you know, you're probably looking at, you know, the housekeeping department, the best of, you know, I mean, doctors where you're in front line, I guess it applies to each one of us at this point of time. So the first thing, I wake up in the morning and I start with, you know, gratitude, because just to be alive at this moment, one cannot, I mean, there is nothing else. I mean, that's the first thing I say. Thank you, Divine, for actually blessing me with another day where I can serve and live my purpose. किसी कारण तो भेजा है मुझे यहाँ पे, और अब तो पता चल गया कि यही करना है मुझे. I want to serve people and this is what I'm doing. I'm dealing with people's minds. So I say thank you for, again, I'm breathing. And Dr. Poonam was also talking about, you know, the breath. You're bringing your focus back on the breath. That's the first thing I do, is I bring my focus and say, ha, I'm alive, you know, and it's great. And I keep my hand on my heart and then I hear my heartbeat. And it's a wonderful feeling, right? And the second thing I do is, music is an eternal part of anybody's life, right? Anybody. And that plays a special role in your subconscious mind. Everybody talks about the logical mind because our education system also is like very left brain. Na? Ye karo, ye na milega. Ye karo, you're like, you know, thank you, Dr. Pankaj is nodding his head. So I'm on the right direction. So everything is rewarded based on some performance. Like on circus monkey, it is like, ye karo, ha, ye na mil jayega. But sadly, we have forgotten where it lies, you know, the subconscious, when 90% of all, you know, our behaviors and everything is happening there. Nobody's talking about how do you, tap that region. So for me, I have internalized music, and for me, it came in easily because I've been trained for, almost 10 years in singing. So I will actually start my day after gratitude. I will start singing, literally, He's something, and this is my favorite song is Kisi Ki Muskurahaton Pe Ho Nisar. That is something that I have, I keep singing. Somehow it puts me into that space ki, yes, now I'm ready to serve. The third thing that I do is, as we associate with music, there is something that you can do. Not every day is a great day. I mean, we are going to be having things which are not great. And sometimes as we go to sleep, we are thinking about what has all happened. It's stock taking ho raha hai. And now with the news and things not okay. And as frontline workers, you're seeing death at close range. It's not easy. You're playing that over and over in your mind again. Maybe you saw somebody struggling, for oxygen and things like that. It is easy, to have those visuals constantly in your mind, and you sleep with it. Your subconscious is registering it. Then you wake up with it. Not very, great way for any frontline worker to be waking up. So as you're associating with those happy memories, you can also detach and dissociate with those things as well, right? So I call it the zoom out techniques. I'll say, chalo, ab to jayenge seedha, moon se I'm going to watch this thing. And somehow it dulls my perception of what I have been, in fact, in saying, I am stressed, I am stressed. It is not I am stressed. I have stress. Sometimes even these small semantics play such a big role. It's not कि मैंने खरीदा है stress कहीं से. I have stress. So which means I can give it away anytime, which means I have to manage those emotions. And as Dr. Poonam was saying, which brings me back to the fourth point, breath. Start focusing on my breath. And people thinking, bhastrika karna, don't do anything. Just bring your awareness to that breath. And yes, there are certain people who follow certain yogic practices. If you all are comfortable, please do it. But everybody now these days gets on to Google, and Google Baba gives every information. So people who have hypertension also do Bhastrika, it goes, it increases they have no awareness. Just focus on your breath. That's more than enough. It brings back your awareness. Suddenly you see what you're breathing when you're stressed, you're breathing here, on top, literally from, I would say, people are breathing from their throats. Then you start noticing that you're breathing deeper, lower from your diaphragm, then from your stomach. And it happens all very quickly. So even if I've woken up with one image of the previous day, something not going okay, somehow this breath calms, grounds me completely, centers me. And somehow I feel the gravitational pull of Mother Earth just grounds me and saying, okay, now I'm grounded. Now I can take it on. And then the fifth thing that I always keep saying is like, just tell yourself, this too shall pass. Everything needs to have that circle. If we just understand, it starts and it has to end. And I think right at the beginning, if I remember, I think it was Dr. Kamal Bakshi. I think she had, she was talking about the very beautiful, I don't remember, ma'am, that line that you were saying, but it was talking about the, belief systems. Again, they're part of your subconscious. जो आप उसमें repeatedly बिठाओगे, that is how you're going to function. That is how your behavior is going to be on a daily basis. So just imagine as doctors, if your belief is like, this is not going to happen. I had a doctor speak with me and she was telling me, you wait for the third wave. 12 to 18-year-olds now, unki ICU ki bari hai. I said, don't talk like this because you're internalizing it. So when you're talking to, your community of doctors, and she's a senior in, I don't want to name, one of the best hospitals in Bangalore. And you're talking to your nurses, you are through your energy passing this on. Negative energy is as powerful as positive energy is. So when we're talking about things like placebo, even a small, ray of hope, you can just tell people ki ho jayega, ye khatam ho jayega, abhi ho gaya na second wave, ab to ho hi jayega. Now who's going to question you? Nobody knows about it, but that kind word can carry so much. And for me, I live that philosophy of, I don't know if you all have heard that Zulu proverb. It's called Ubuntu. Okay. It's like, I am because we are. The minute you start taking responsibility for your own state of mind, right? Ki, mujhe ye theek karna hai, sirf apne liye nahi, but because I can impact my entire circle of influence. Bhale wo ek aadmi, Bhale it is just smiling, you know. I in fact now I do more video calls because I think people say, you know, आपका खिला हुआ चेहरा देख के ना somehow I feel कि सब कुछ ठीक हो जाएगा. चलो ठीक है, कर ही लेते हैं. अब नहीं करूंगी तो कब करूंगी, right? So even if one person is impacted, I think yeah, चलो I think I have lived my life on planet. I'm you know I'm not कोई picture का dialogue नहीं है, but that is how I feel now. You know, it is that time when each one of us is fighting our own battle. I can't compare, you know, let's say your battle with my battle, mine with somebody else. Everybody is going through something that we are absolutely not aware of. That let's be compassionate, let's be more kind. There is never a better time than now when people ask me, do I have to be grateful that I'm alive? I said, no, what am I going to say? Yes, your heart is breathing, no? I mean, it's beating. You're alive. Aur kya chahiye? You know? So yes, it has not been easy, just like y'all deal with physical health, where, you know, I'm dealing with mental health, and mind and body are part of the same system. What happens, you know, physically affects our mind. What happens in the mind affects the body. It probably starts with something very simple, you know, as acidity. And then people are saying, you know, they're talking about heart attacks. It starts as a seed somewhere. So if we could just start with us,